My name is Holly Edwards. I work at Engadine Veterinary Hospital, and today I am showing you my video evidence for a dental procedure. At the moment, I am currently drawing up our Faxan to induce our patient. She's a female cat who has some moderate plaque and tartar buildup, potentially a grade 2 or 3 dental, and might need some extractions. Here I'm drawing up some alfaxan into a syringe. I've calculated her dose to be 2.4 mils depending on her weight. In some of the next shots, I'll be showing you everything that I collect together to be organised for a procedure. I put this all in a kidney dish or a tray to make sure that everything is available when we need it. So this includes everything for the IV, some ET tubes, sandbags, towels, the kit, equipment for the dental machine, and everything that we could possibly need in preparation for starting the procedure. Here I am currently setting up our dental machine. So this is taking our dental heads out of an autoclaved packet and attaching them to the dental machine. I do lubricate every time before I attach the heads to make sure that they're working properly. Here I'm performing an examination on the cat. I'm checking her vital signs, looking into her mouth to assess her teeth just from the outside, and noting to the vet what I discover. Here I'm currently taking her heart rate down, and soon after me, Rita will just be checking to make sure that that is correct. So now we're starting to put her IV in. I'm restraining the patient. She is quite subdued because of the pre-med, so there wasn't a lot of restraint necessary. Rita will be putting the IV in. I'm just holding the cat's head up, not putting too much of a firm grip, but just enough that if she was to jolt, I would be able to stop her from potentially biting or scratching. And I'm holding up her right cephalic vein for Rita to be able to put the IV in. So now that she has been induced, it is time to put her tube down her throat. Now we do have the lignocaine spray that we use before every feline patient. Rita sprays this down into the throat, and then we put the tube down. I chose 2 sizes for today's procedure. One was a 4 and one was a 3 size tube, just in case one or the other didn't fit. Here I'm currently tying in that tube, so I use the string, wrap it around the tube, hook it underneath her canines and tie it around the back of her head. We use the sandbags to hold down the breathing circuit so it doesn't flick off the table. Because she's under 10 kilos, she is hooked up to a non-rebreathing circuit. Now that she has been induced, we can do a proper oral examination. So I'm just using a probe here to assess each individual tooth to see if there's any gum recession or root exposure. So I'm just using the probe to run along the gum line of each individual tooth. Rita here is just supervising me, also double checking the teeth, any that we think need to be extracted. From probing one of the canine teeth, it was a little bit suspicious, so Rita did make the call to do some dental x-rays. So this is her currently taking a dental x-ray of the right upper jaw. This was the canine that had a fracture, so we're just seeing what the gum line and roots look like under dental x-ray. Rita decided to take another radiograph of the other top canine, so this will be the left side of the mouth. The first one was a little bit suspicious under radiograph, and it looked like there was an abscess forming at the root, so we have decided to take an x-ray on the second side. I am also again probing this side, just because this has more of a view. We do like to flip over and assess this way. So again, I'm probing each individual tooth while Rita supervises me. Because the canine that needed to be removed was quite a heavy extraction, Rita has decided to suture it closed. Here I am passing some needle holders and some scissors for her to complete the suture. So Rita did decide that from the radiographs that canine tooth did need to be extracted. So while she is doing the extraction here, I am just doing some anesthetic monitoring. Once the canine tooth had been extracted, it is now time to scale and polish. I'll be doing this portion of the dental. I'll be scaling both sides of the mouth, top and bottom. Once I have done the whole scaling, I will also be polishing each individual tooth. Now that the procedure has finished, I'm just preparing the patient for hopefully a smooth wake up. I have turned off the ISO, connected her to the oxygen still. I'm giving her some subcutaneous injection of Metacam here for pain relief.